So good afternoon, good evening, colleagues and faculty. You can hear me?
Yes, we can see the presentation and we can hear you very well.
Yes.
Okay, so this is group 4 members, and we are Kiren, Brian, myself, and Valerie. And our question was, we were to review and discuss recommended PI from IMA for the fixed dose combination of pyronaridine, tetraphosphate, and etoposide, that is Pyramax, in our local African population. Then after going through the product information, we suggest what additional changes or requirements are required with appropriate justification. And this we did focusing on the therapeutic indications, the posology, method of administration, contraindication, special warnings, precautions for use, interaction with other medicinal products, and other forms of interaction, PD and PK. And so it was a summary. So in case if you want to stop me anywhere, you can stop me. If one of my members wants to chip in, they can chip in. So the first one was section 4.1, therapeutic indications. And you have seen what group 1 presented. Pyramax tablets are indicated in the treatment of acute and complicated malaria infection caused by P. falciparum and P. vivax in adults and children weighing 20 kilograms or more. So from that, we noted that malnourished children who are below 20 kilograms are not taken care of. And so in our assessment, we wanted to ask the sponsor, because we have other forms of plasmodiums like P. marali and ovale. So we needed some additional clinical data to show Pyramax is effective against P. marali and ovale and mixed species infections. Yeah. If the patient presents with both Plasmodium vivax infection and falciparum and malaria and ovale, can we still use Pyramax and be effective? The second one is, if Pyramax is not effective against these mixed species infections, then can the sponsor advise whether we can use another antimalarial product like chloroquine with no drug interactions and still achieve a positive therapeutic outcomes in these mixed species infections? And number 3, so need the applicant or the sponsor to provide clinical data on whether Pyramax can be indicated in children under 5 kilograms, the malnourished, which is prevalent in Africa and Kenya as a country. So the next section we looked at was 4.2, the method of administration, and these sections we agreed what was given, the dosing, the posology was well taken care of, and we had no issue to raise that section. Next was contraindications. And what we found out was missed here is that in our African region, we have some high prevalence of tuberculosis, HIV, some neglected diseases like lymphatic filariasis, trypanosomiasis, sickle cell, and this was not captured in the product information. So we wanted to request the sponsor applicant where they can provide data on whether Pyramax can be used in patients with such conditions, and if not, then they should provide a clear contraindication for such concomitant diseases. And the next one was what we have said, that Africa is a challenge of malnutrition, and so children below 5 kilograms, how can this product be applied on these kids with no issues? I think you can hear me, eh?
We can hear you.
Okay, fine. 4.4 was special warnings and precautions for use. And we had one point of this high prevalence of glucose 6 phosphatase deficiency in the sub-Saharan Africa, and this was not captured in the product information provided for Pyramax. So with this in mind, we wanted to request the sponsor whether they can include the screening of 6 phosphatase deficiency before initiating therapy, and what would be the effect of Pyramax on patients with this deficiency. And next was interaction with other medicinal products and other forms of interactions. And what was coming in mind was, since Africa has this prevalence of these diseases, so most of the patients who will be getting this malaria will be taking TB drugs, lymphatic variolis treatment, and because it was not captured in the PI, we wanted the sponsor to provide additional information whether Pyramax can be used in patients with TB and other neglected diseases who are actively taking the medications for these diseases. And before that, we also talked about herbal products. Herbal is a huge area in Africa. Most of our people use herbal products even before going to the hospital or pharmacy, and therefore we needed information on herbal and Pyramax interaction. Next was pharmacodynamic properties. And from this section, after evaluation assessment, we needed the sponsor or assessor to provide local data on resistance to Pyramax, since it has been documented that there is a resistance to artemisinin-based therapies, and our product has artesunate. The next was, we needed the sponsor to provide a recommendation for use of Pyramax in mixed infections, which I've talked of the mixed species infections of the 4 Plasmodium species. And then our guidance on the management of repeat episodes to malaria and how to monitor incidence of resistance of the same. And then lastly, it was pharmacokinetic properties. It was well taken care of, except because we had request for additional data on patients with 5 kilograms and below, that's children. So we needed whether the sponsor or applicant can provide some PK studies data in malnourished children, which is specific to our local population. And that was the end of our discussion. Any questions, and my team members can come in. Thank you.
Yeah, Emmanuel, many thanks for that good presentation. Could you please comment regarding the other team members? So that was a team effort, that whole presentation. Everyone from your team has contributed more or less in a same amount, or can you comment on that?
Yes, Prof, we did this as a teamwork, and then I was to present as what Group 1 said for floor purposes, and they are all here. They are ready and eager to answer to your questions. Thank you.
Perfect. I have a first question and then hand it over again to Luther. And that is, you mentioned in your presentation, the slides, like the one that we see now, says now there's a request to the sponsor to provide certain data, like specifically malnourished children or drug interactions. Was that your suggestion, or was that actually included previously in the regulatory submission process? So what I want to ask is, Is that your ideas, what you would ask, or is that something your agency has already asked during the process, during the regulatory submission process? And same question as Lusa had asked in Ghana before, is the product now approved in in Kenya or?
Maybe I can step in and assist with answering that question. We did use the SMPC that was approved by IMA as the template for us to ask these questions. And in Kenya, we have Pyramax granules for oral suspensions. They have been registered in the country. For the adult one, it has not yet been registered. Thank you.
And are these questions that you ask, for example, is there information about malnourished children in your product information in the country?
I don't think it's in that product information, but it's something we can ask. Ideally, what we normally ask for is a risk management plan, risk minimization plan, and also PSUR data. So we keep following up on our population on the same, just to make sure that the product is not affecting the population as much as they are using it. For Kenya, we have majority of the people being malnourished and also having diseases that were not covered in this SMPC. And we felt like these are questions we could ask if we had this information at that time. But I think if we get the next application for the adult product, we might ask that question. Thank you.
Perfect, thank you.
Yeah.
And with this, I would like to hand it over to Luther.
Thank you, Group 4, and thank you, Ben, for those questions. So this is also an interesting one, I think. So one is, for me, it's a general comment. I think the intention is that, and I hope that's what happened, that every group completed all the weekly assignments, which means every group looked at the TPP, you looked at the benefit risk, you looked all the items. What you're only presenting is, just one part. So, but the assumption is you already have the other background, and that should be informing what you are presenting as well. Just also to make sure that this is clear, that you're only presenting one part, so that we don't have repetition, that all groups are presenting the same parts. So that's why you're presenting differently, so that the whole should speak to that part. Now, so you have a lot of questions that you have, which is similar to what Ben was asking. That for me would go back to the TPP, for example. And so from what you are suggesting, it seems like you are saying the target product profile itself, may not be sufficient for this, because if I'm a manufacturer, I use the TPP to design how I'm going to do the studies. So that's my first comment, because I think you raise quite a number of comments. One obviously is about malnutrition, which is valid. So maybe the comment would have been also if the TPP itself, when it's describing, what should be the target for this product, maybe that was not sufficient because there's a significant group, in your opinion, that should have been included, but maybe it's not included where the product is needed. And the second one, I think you're also picking on a number of, I think, contra indications for those diseases. So maybe that's one comment. And then the comment I have, maybe the question for you is, you mentioned about TB products, but I understood from the previous group and also from the TPP that the applicant or the manufacturer did show that there is interactions with the TB products. And is your question that it was not included in the product information, this aspect of interactions with TB products, or you're asking for something else additional? Because I assumed that they already have that data, that it's you have interactions with HIV products and also with the TB drugs. But in your comment, you were raising it as a question. So any thoughts on that?
Thank you for that question. This is Brehan. I think I'll attempt to respond to the question, and my colleagues can also jump in to provide more clarity on where maybe I'll be short. So for us in this section, we looked at the comorbidities that we have in our local setting. Again, tuberculosis is of high prevalence, the same case with HIV and AIDS. So for us, we needed more elaborate data in this section, especially due to the drug-drug interaction that we anticipate. Again, due to the liver toxicity for the drug, and also because the TB medications and also HIV medications also have a greater potential for causing liver injury. Again, that was an area we felt that we needed more data on. I'll welcome my colleagues to contribute further. Thank you.
Yeah, also maybe to add is that I think under contraindication and referring to comorbidities, we noted that the SMPC was silent when it comes to tuberculosis, in the sense that we all are aware that tuberculosis, one of the forms is miliary TB, and it causes widespread liver toxicity. So in the fact and the setting that this product itself is implicated in causing hepatotoxicity, we wanted to know whether if someone has these comorbidities, you are suffering from TB and also get malaria, is it something that you can actually advise the patient to take alongside this medication? So we found that the SMPC was silent in that condition. So we thought it would be wise to ask for more data, or maybe they could clarify that it's contraindicated in these conditions that can actually worsen hepatotoxicity.
Okay, I'll come back and follow up on this, but I saw Bilka had a hand up.
Yeah, thank you, Yusuf. Thank you to the group. Excellent presentation. I do have a question. You mentioned several concerns regarding comorbidities and so on. For me, it's a question, do you want to see pre-approval studies? Do you want to make contraindications, or do you want to make post-approval pharmacovigilance studies? This in line with thinking about when you are delaying the marketing authorization, you do have a different benefit risk for those who are not treated, will not be treated. So perhaps my question is too complicated, but clear. Do you want to have pre, during, or after approval the information? Thank you. Thank you for giving me the chance to asking, but it's very, very challenging.
No, actually, it's perfect, because that's what I was going to ask. Because here, that's why I clarified in the beginning my comment that the group, the assumption is they've already looked at all the other assignments, right? Which includes, the TPP. They've also looked at the data that was provided, which is exactly to your question, to say now they are reviewing the product information, and based on what they're asking, it's not clear. So it's a perfect question, which I was also going to ask, but you put it very nicely, that what is it that the group is asking? So over to you, group 4. What is it that you are asking, considering you are reviewing the product information? So what exactly are you asking on those aspects as requested?
Maybe I can go first, and then my group members can come in. So maybe if we take a scenario that this product is coming to Kenya, for instance, and we are assuming that if this product has gained marketing authorization in other African countries, probably this is data that is available by the manufacturer. So I think that would be more of pre-approval studies for them to convince us that if this product is safe in certain comorbidities, like as we said, tuberculosis is one of them, sickle cell diseases, and other neglected tropical diseases. Are there other studies that they're performed in the African context to back up the suitability of this product in the African market? And of course, if there are other studies, maybe post-approval studies that have also emerged in countries where this product has been registered, it would also provide a solid foundation for us maybe to considered for registration.
Let me rephrase. Did you look at the clinical studies, that were conducted to demonstrate safety and efficacy?
Well, as part of this assignment, I think
No, during the course.
Yes,
During
I think
the
that
course.
was something that I think it was a part of the presentations that we had gone through, but not specifically for this assignment. We
Because
thought,
I assumed in one of the groups, in one of the weekly, as you were doing it, there were those tasks for you to go and look at. And part of it was to look, everything that is presented by all the other groups, everyone should have done that. Your presentation is just a presentation, but in terms of the tasks during the whole course, everyone should have done all the different parts. So the question I'm asking is, did you look at that? Because it leads to the way that you are discussing here. Because if you looked at the clinical studies, right? If you look at clinical studies, they describe the population, of where the study was conducted. So the questions you're asking, when you just look at the clinical studies that are, the pivotal clinical studies, you can have that information. And then if you look at the indications, which groups, and also if you go back to what we're discussing about the TPP. So all these things that you're talking about would have been covered in those prior tasks. So that the question here is exactly as Bilka asked, are you asking for post-authorization? Are you asking for changes to the product information to reflect what you're talking about if it's missing? Or are you asking for post-authorization, which would come, I think, to the group looking at risk minimization, if I'm not mistaken? So what is it that you are asking?
Maybe to step in and add in on what my colleague has said, we were looking at the SMPC, keeping in mind that it is what the healthcare provider looks at when they're administering this product. So we looked at the deficiencies that were in the SMPC that is already published, and came up with additions that can be input into the SMPC. And we were looking at it as a first application that has come to us as a dossier. So the applicant can either submit responses, either giving commitments that they'll provide that information once available, or give an alternative, but this will not derail us placing the product in the market. I don't know if we've answered the question.
I think for me it's not necessarily about answering the question. I think it's I have a sense that the groups are looking at the group presentations in isolation. I think that's the sense I'm getting. Whereas the idea is, ultimately what you're looking at is the whole continuum of the things you do as a regulatory authority. You're going to get data, and you review that data. And what you are covering is how do you review this data so that you can come up to a decision. And the outputs that you are coming up to is exactly all the things that you are discussing. So it should be like a continuum, not for you just to say, we just looked at the SMPC alone. The idea was you're looking at the SMPC, but you also have looked at the clinical safety and efficacy in the other parts of the assignment. You're also familiar with the benefit risk assessment, so that when you're looking at the product information, the critique that you're doing for that information, and you have done a very good, so don't get us wrong. But I think what we're trying to clarify is how would you be asking for these things? Is it that, at this stage, for example, what you're showing on the screen, when you say provide the pharmacokinetic studies in malnourished children and local specific pharmacokinetic data. So taking into account that what you're looking at is the product information. This is what you get to when you've done the review, right? You have already received the data, you have reviewed it, you have done the benefit risk assessment. And if we make assumption from the prior groups, you are positive on the benefit risk assessment. And now we are saying, with what you have covered about product information and what should be contained in there, now you have this. If we take it as a deficient that you think, oh, it doesn't say anything about malnourished children, and we think it's important. And we are making an assumption that in your group, you'd have picked this when you're looking at the benefit risk and what are the gaps and things like that. So the question maybe to rephrase is, what would you be asking here? Are you asking them to do additional studies, later on, but the pharmacokinetic session, that you have is fine? Or are you saying, we need to have some changes? And if you go back, I think when you're talking about contraindications, for example, so each time when you're saying provide studies, I think we are more or less asking that just take into account that this is about product information. The next part, I think, is about risk minimization and post-authorization studies. So whatever studies that the colleagues there will be asking should be linked to what you're doing. So just to clarify, that I think you have the information, but it's more of what you're actually asking, or the action that you're talking about, just specific to product information. But in terms of time, I think we have 3 minutes, maybe just to see if there's any additional comments or questions before we move on.
Also comments again from the others, either from the other faculty members, but also again from the other teams.
I see Peter has his video up.
Well, it's just being polite, really. We could ask an additional question to this group about how important is this lack of information on these two species of P. ovale and P. malariae. I mean, you asked the question as to whether there should be further studies done. Is your judgment that this is necessary, or is this just a relative? I mean, for instance, are there other clinical trials available which cover these other species, or is it fundamental that you have to do studies against the specific species?
To answer that, there have been studies that have been done in Kenya showing the prevalence of this species. That is, for example, P. malaria, we have a prevalence of 9% of infections. And for P. ovale, we have 1.5% infection prevalence. As much as this is low, we feel like if this product is administered to a patient who is suffering from a malaria infection from this species, complications might arise and it might be fatal, since it will not be effective. So we felt as a group that that information would be relevant, if available, to be included in the product information.
Okay.
Yeah.
Thank you. And we're well in time. Last comment from me, and that is more philosophical comment, and that is when I hear the discussion now again about you get all the data now in a regulatory submission dossier. Now you think something is missing, and now you scratch your head and say, what shall I do? Shall we now postpone the decision and wait for more studies? Or with the limited data, still do a regulatory approval and then all sorts of other recommendations? Would that not be a better approach to go for a scientific advice procedure in the countries, or in some of the countries, before going into the clinical trials, and say 2 years before regulatory submission, and then make all these recommendations well in time? That is more for discussion and for thinking, not to conclude on now here, but that might be a way forward.